Good afternoon, everybody. The learning objectives of this presentation are that you'll understand what's wrong with our indoor air, that you'll become familiar with multiple chemical sensitivities, and that you'll find ways to improve indoor air quality. The question is, how acceptable is our indoor air? Let's first look at the building code, the purpose of which is to protect public health and safety. Regarding indoor air quality, codes generally refer to the American Society of Heating, Refrigerating, and Air Conditioning Engineers, or ASHRAE, Standard 62.1 for ventilation for acceptable indoor air quality. This is the commonly accepted standard for architects and engineers as best practices worldwide. So how do the latest versions of ASHRAE Ventilation Standard 62.1 or 62.2, which is the residential version, define acceptable indoor air quality? They state that there should be no known contaminants at harmful concentrations as determined by cognizant authorities, which are defined as an agency or an organization with the expertise and jurisdiction to establish and regulate limits for airborne contaminants. But some important pollutant concentrations are not specifically addressed, such as contamination from outdoor air, or mixtures of pollutants which we experience in real life. Instead, it defines acceptable indoor air quality as being air quality in which 80% or more of the people exposed don't express dissatisfaction. That's it. Health Canada is a cognizant authority. In 1995, they published a technical guide for indoor air quality in office buildings, which is 28 years old and clearly outdated. They have now drafted a new technical guide, which is available for public opinion online until April the 9th. And you can check it out and provide your own comments, criticisms, and suggestions. I would like to point out that they state that the goal of this document is to maintain good indoor air quality, but they never define what that is. So is there something wrong with our indoor air? The air quality in your house depends on where you live. For example, climate change can increase ground level ozone and the amount of allergens found in the outdoor air. It also depends on what region you live in. This is a picture of the potential effect of the United States coal mining industry on the air quality in Canada just by the way regional winds move. There's a difference between urban and rural air. Urban air is more affected by the burning of fossil fuels, by transportation and buildings, and rural air can be impacted by farming activities. Regarding your neighborhood, what's the traffic like? And how close do you live to a major roadway? We know that urban air is more polluted than rural air, and 82% of Canadians reside in urban communities. This is significant because the evidence is robust for adverse health effects from very low concentrations of common air pollutants. In fact, there is no known safe exposure threshold level. Major outdoor pollutants are gases and particulate matter. In particular, the gases include nitrogen oxides, especially nitrogen dioxide, ozone, sulfur dioxide, carbon monoxide, polyaromatic hydrocarbons, and volatile organic compounds. The asterisks are next to nitrogen dioxide, ozone, and particulate matter because the evidence is robust that these three particular substances have a strong impact on health effects. Exposure to these gases and particulates is continuous but fluid, with levels and ratios waxy and waning. Together, their influence is additive but could even be synergistic. The World Health Organization tells us that air pollution is one of the top 5 major risk factors for developing chronic non-communicable diseases, such as cardiovascular, respiratory, and neurodegenerative disorders. The first 4 are well known: tobacco use, unhealthy diets, physical inactivity, and harmful use of alcohol. Air pollution is now one of the top 5. Many chronic diseases are associated with long-term outdoor pollution exposures. However, people spend 90% of their time indoors, meaning that we are studying the impact of these long-term outdoor air exposures on people who are indoors. How much does the building envelope filter outdoor air? Well, About 65% of the outdoor particulate matter at 2.5 microns is inhaled indoors. Ultrafine particulate matter, which is less than 0.1 microns, or nanoparticles, is more poorly filtered. It is not just the most plentiful of the particulates, it's also the most toxic. This is a nice diagram comparing the varying sizes of particulates in the air. The smallest thing we can see is about 50 microns. The width of a hair is 100 microns. When we study the health effects of particulate matter, we start at 10 microns, which is the size of a large cell. The most frequently studied size is 2.5 microns or lower, which is the size of bacteria. Particulates can be smaller than 0.1 microns, the size of a virus, or even smaller, which we call ultrafine particulate matter or nanoparticles. Buildings are not airtight. Outdoor air and its pollutants can infiltrate the indoor environment by infiltrating under doors, through cracks in the structures, and around windows, which are not perfectly sealed. It is brought in by mechanical ventilation, and it certainly enters the house when we open the windows and doors. The building structure may filter the outdoor air pollutants, but indoor air quality is actually worse than outdoors. The main factors affecting indoor air quality are the outdoor air quality, the things that we humans bring into the indoor environment which contaminate it, and the building and construction materials, furniture, and various types of indoor equipment which off-gas chemicals. Indoor air is more polluted with chemicals than outside. Chemicals in the indoor air include volatile organic compounds. These are all organic chemical compounds that can evaporate under normal conditions. Organic just means that the molecules contain carbon. Some of these chemicals are semi-volatile, meaning that they tend to partition or go back into a solid phase when they have contact with surfaces, such as dust and particulate matter. In fact, when they're attached to the ultrafine particles in the air, they can be translocated directly and easily into the blood and the brain. Volatile organic compounds are formed outdoors due to the combustion of fossil fuels. But VOCs are the major emissions from various consumer and industrial products, collectively known as volatile chemical products, and are found 2 to 5 times higher in the indoor environment. Up to 50 different VOCs are found in more than half of Canadian homes. They predominantly originate from indoor sources. These include the obvious ones, easily identified by their scents, such as the fragrances and scented products used by the inhabitants. But they're also harder to detect VOCs from furnishings, furniture, carpets, adhesives, curtains, blinds, shades, and building materials like engineered wood products such as parquet, particle boards, wood paneling, and plywood, etc. The long-term outdoor exposure studies of the health impacts of pollution are confounded by the indoor chemical environment. More than 300 chemicals have been identified in the indoor environment, but over 40% of them don't have available health standards. And those that do are based on single exposures in occupational settings. We don't have any relevant indoor health standards for SVOCs, and we don't have standards for real-world mixtures of chemicals. The ASHRAE ventilation standards do not sufficiently protect us from the chemical exposures in the indoor air. They say there should be no known contaminants at harmful concentrations, but cognizant authorities cannot regulate limits when they haven't even been established yet. This image of particulate matter, according to size, helps to explain a couple of points. VOCs, and especially SVOCs, can adsorb or get stuck to the surface of particulates. It's a basic rule of physics that because smaller particulates have less mass, they will have a relatively greater amount of surface area. The ultrafine particulates have the largest relative surface area and thus carry the highest amount of adsorbed potentially toxic material, such as the VOCs and SVOCs. The coarse particulate matter gets filtered in the upper airways and don't infiltrate deep into the lungs. Maybe they'll cause some local contact irritation in the upper respiratory system. The 2.5 micron fine particulate matter can penetrate further down into the deepest part of the lung and even the alveoli, the air sacs where the oxygen and carbon dioxide exchange takes place, and some can enter the bloodstream. But the ultrafine particulate matter, which are the most plentiful, easily get through the barriers of protection to enter the bloodstream and enhance the translocation of the adsorbed chemicals into the body. This image illustrates that we're exposed to chemical pollutants over our whole lifetime. A multitude of various chemicals come from external sources like indoor air, outdoor air, our food, water, drugs that we take, and the personal care products that we apply to our bodies. Sometimes we can break them down and eliminate them very easily. Sometimes we can't do that so efficiently enough, and so they get stored in our fat. The term that's used to measure this is the exposome. It's the study of our exposures from womb to tomb. The point is that everybody is contaminated with chemicals. The average North American contains up to 200 of them. Some of these chemicals are detoxified slowly. Some can be eliminated quickly, but if our exposure is constant, like plasticizers such as BPA, they're still found in 90% of the population. And BPA substitutes are no better. Chemicals that are water soluble are easily excreted by the kidneys, but many are lipophilic, meaning they're absorbed by fats and oils. The impact on our health from exposures to chemicals with the potential to be harmful is related to both the dose and duration of exposures and our ability to detoxify and eliminate them. How well do you think you detoxify? This slide just gives a list of what's commonly found in most humans. I won't bother to read it out loud, but as you scan down, you can see that it's quite extensive. What we've learned from our studies of evolution is that cells and organisms have survived and evolved by being able to protect themselves against a changing environment. They can sense toxic compounds because they have sensors on the cell membrane to do that. Some of those chemicals are endogenous, by byproducts of cell metabolism. Some are foreign, produced by external sources. When they're sensed, these compounds stimulate cellular detoxification systems so that the chemicals will undergo biotransformation, breakdown, and elimination. And if the individual cell can't do it, it tosses the chemicals into the bloodstream so that the job can be completed by the liver, which specializes in detoxification and then be eliminated by the kidneys. Detoxification is a fundamental and essential feature of defense mechanisms inherent in every cell. When they're overwhelmed or inadequate, it can induce or increase cell damage. This phenomenon is also known as oxidative stress. It is the primary pathway to the development of chronic diseases associated with air pollution. Effective detoxification occurs when the toxins in our body are counterbalanced by antioxidants, which is why you need to eat lots of fruits and vegetables. Our ability to adequately detoxify is decreased when there's an increased burden from exposures, or if the nutritional support is inadequate from not eating enough antioxidants, or if the genotype for detoxification is a variation of normal. Some of us are just better at detoxifying than others. When any of these issues occur, the detoxification system does not function adequately, and as a result, we start to create damage to cells, causing dysfunction or even cell death. So pollution can have an influence on developing a variety of disorders, including atherosclerosis, dysfunction of the lining of our blood vessels, high blood pressure, neurodegenerative, neurodevelopmental disease, chronic migraine, allergies, autoimmune disease, systemic inflammation, diabetes, even obesity is related to pollution. We're more likely to develop rheumatic diseases, degenerative joint diseases, gastrointestinal conditions such as non-alcoholic fatty liver disease, inflammatory bowel disease, skin eruptions like eczema and psoriasis, chronic kidney disease, and environmentally linked conditions such as myalgic encephalomyelitis chronic fatigue syndrome and multiple chemical sensitivities. There is evidence that all these conditions have links to pollution exposures. So what exactly is multiple chemical sensitivity? MCS is an acquired condition. People with MCS describe multiple nonspecific symptoms, most commonly involving the central nervous and the respiratory systems. The one common characteristic is that the provocation of symptoms is linked to exposures to low levels of chemicals that are common and ubiquitous, that were previously tolerated and are tolerated by everybody else. The most common symptoms include migraine headaches, cognitive impairments such as difficulties concentrating, breathing difficulties like shortness of breath, cough, wheezing, and nasal congestion, as well as symptoms like nausea, heart palpitations, and skin problems. The most common triggers are the VOCs, in particular, those commonly found in the indoor air, especially scented products, which are easily identified by their smell. There are no biomarkers on physical exam or from lab tests to aid in the diagnosis, and there's no known treatment for MCS. So the best management is to avoid known triggers. Avoiding chemical triggers because of MCS interferes with one's ability to carry out fundamental activities of daily living, like attending work, or shopping, or participating in social activities, being able to use public transportation, and even attending medical facilities. It is a common experience for people with MCS to have to deal with the skepticism directed at them by other people who don't believe them and aren't supportive. And this can include friends, family, coworkers, employers, and even healthcare professionals. As a result, people with MCS often must avoid social and occupational settings because of widespread use of chemicals and people's unwillingness to limit their chemical use. This results in stigmatization, loss of meaningful and productive activities, social isolation, financial loss, and feelings of anxiety and depression. And as a result, people with MCS are more than frustrated by the barriers they have had to face, and many are devastated by the losses that they've accumulated. Anybody can get MCS, including children, but the cohort most commonly affected is middle-aged women, and they're more likely to experience poverty, and they're more likely to be poor detoxifiers. There are 7 published studies, if you're interested in reading them, that have demonstrated that MCS patients have more genetic variants for poor detoxification compared to controls. And non-communicable diseases associated with air pollution are also associated with variants for poor detoxification. They include cardiovascular disease, respiratory disease, neurodegenerative disorders, chronic kidney disease, male infertility, risk for fetal spinal bifida, cleft palate, cleft lip, and several cancers, and of course, multiple chemical sensitivities. And here's a dozen papers showing that the association of non-communicable diseases with genetic variations in detoxification. Can we actually become sensitized to chemicals? Being sensitive to low-dose exposures does not correlate well with traditional toxicology, which states that the dose makes the poison. Even water can be toxic if the amount you drink is too high and dilutes all your electrolytes. But this paradigm is 500 years old, and it's now shifting because we now know that some chemicals can also have effects at low doses. An example of chemicals that can have different effects at low doses are the many chemicals described as endocrine disruptors, meaning that they interfere with the functioning of hormones. It has been estimated that there may be at least 1,000. One recognized human exposure source has been the indoor air and dust contamination from building materials and furnishings. They include phthalates, PCBs, which were banned in the 70s but are still persistent in the environment, brominated fire retardants, which have been banned more recently, and stain repellents. Endocrine disruptors can disrupt hormone messaging a variety of different ways, one of which is binding to receptors. These are specific structures on cell membranes which can bind and respond to specific substances, kind of like a key in a lock. For example, here's hormone A. And as you can see from its structure, it fits perfectly into one specific receptor, which the cell can sense and interpret. But other differently shaped chemicals or hormones don't fit, but they can fit into a different receptor, sending a different message. Endocrine disruptors fit into receptors where they really don't belong and can mimic or even obstruct the messaging of hormones. The point to be emphasized is that chemical pollutants can bind to other kinds of receptors at low doses. So if a foreign chemical has an affinity to bind to a receptor, it can stimulate it and initiate changes in cell signaling and function. And even very low but repeated doses can stimulate the cell to produce even more of these receptors. This is called upregulation, which results in increased ability to detect the chemical and increased responses by the cell to the perceived message. In 2021, doctors David Julius and Artem Patapuchin received the Nobel Prize for Physiology or Medicine because of their discovery of a family of receptors called transient receptor potential receptors, which we'll just refer to as TRP. This discovery led to our understanding of the molecular basis of how nerves can convert sensory stimuli into signals that are sensed by the brain. These receptors respond to multiple chemical and physical stimuli and transmit the signals into cells. Most significant is the robust evidence that these chemosensitive receptors can become sensitized. There are now 20 studies published in peer-reviewed journals which show the two members of that TRP family, TRPV1 and TRPA1 receptors, are sensitized in multiple chemical sensitivities. In 2021, the Ministry of Health of the Government of Alberta published the results of a systematic review of MCS. A systematic review is a scientific methodology by which one transparently gathers all the published reviewed studies and commentary of a particular subject or question to be answered, evaluates the validity and strength of every paper, and then summarizes and objectively puts together what the literature actually says. In this case, Alberta Health weighed the evidence as to whether multiple chemical sensitivities exist, whether it's just a psychological false belief system or whether it's biological, and if so, what mechanisms are involved. The weight of evidence from this systematic review is clear that MCS is due to neurological sensitization to chemicals with changes in olfactory processing. People with MCS really are the proverbial canaries in the coal mine. They're warning us that our ubiquitous everyday chemical exposures are not safe. The difference is that the rest of us don't feel the effects of the chemical exposures until it's too late. Data collected by Statistics Canada from the Canadian Community Health Survey over 20 years, starting in the year 2000, show that the percentage of the prevalence of Canadians diagnosed with MCS has almost doubled. Unfortunately, there are still people who erroneously believe that the cause of MCS is anxiety and that it should be treated accordingly. Note that 1 out of 3 of MCS patients develop emotional problems after the physical symptoms have emerged, which is not surprising given how devastating the effect can be on quality of life. Obviously, the cause of a problem cannot occur after the problem has emerged. So using supportive psychotherapy to help MCS people cope can be effective, as shown by the likelihood to help versus harm ratio of 6 to 1. But using psychotherapy as a treatment to cure MCS doesn't work, but it can be harmful if the MCS patient perceives stigmatization. It's just in your head. Using anti-anxiety and antidepressant medications to treat these people is more likely to harm than help. MCS is recognized as a medical disability by the Canadian Human Rights Commission, as well as some provincial commissions, and they recommend that patients or workers must move to a safe accommodation tolerated without symptom provocation. The help to harm ratio for chemical avoidance is 119 to 1. And having a chemical-free living space is endorsed by patients as the most beneficial management. at 155 to 1. Clearly, we need to provide a living space to people with MCS, which is as chemically free as necessary according to the individual needs. But how do we do that? How should we construct multifamily units to prevent contamination from other units? Should we bring in more outdoor air? And if so, should we filter it? What filters should we use? Should we filter the recycled air too? Apparently, that's the least effective method. What about increasing the ventilation? We know it improves productivity by reducing the VOCs, so the cost of increasing the energy consumption is covered in large buildings. But what about the impact on global warming? And maybe we should be filtering the ventilation exhaust because we're contaminating the outdoor air with the indoor VOCs. Which filters should be used? Air filters are good at lowering levels of particulates indoors, including PM 2.5, bioaerosols, and viruses, but are less effective for UFPs. Should we be using filters with a higher minimum efficiency reporting value or MERV than 13? It should be noted that HEPA filters don't filter VOCs and are not as efficient at filtering the ultrafine particulates, which absorb chemicals on their surface. However, VOCs and ozone can be filtered by activated charcoal or photocatalytic oxidation. The contribution of indoor VOCs to the outdoor air is significant. Outdoor VOCs contribute to the development of ozone and secondary organic aerosols, but we've done a good job legislating vehicle exhaust, VOC emissions, and have reduced the outdoor air levels over the past 20 years. But now, indoor VOCs exhausted into the outdoor air are contributing up to 80% of outdoor VOCs, depending on the density of the population. What we need to do is eliminate indoor sources of chemical pollutants as much as we can. We should be promoting changes in human behaviors by initiating and enforcing scent-free policies. In order to do so successfully, the public needs to be educated. They need to understand why. They also need to be better informed regarding the product choices they make. But being better informed requires transparency and labeling of the pollutant contents of the products they buy. Perhaps it's time to change the laws regarding propriety for fragrances, scented products, and building materials and furnishings, because protecting consumer health should be prioritized. What we also need is the use of safer building products and furnishings, because they are a significant source of air pollution both indoors and outside. This graph is copied from a very recently published paper, which shows the increased amount of VOCs in the indoor air from the use of cosmetics and toiletries in England over the last 20 years. People don't likely know the negative health effects of what they're putting in the air because there's no transparency. On the other hand, transparent communication and education can drive the market to change. This is a graph taken from that same recently published paper, which shows a reduction of almost 50% in the amount of VOCs in the indoor air from paint over the last 20 years. Many consumers now know about low VOC paint. Once the market was better informed and people started asking for low VOC paints, the industry responded accordingly by reducing the price. So here's the challenge to you, the people involved in the building industry. What can you do to improve indoor air quality? Thank you.